the adults over age 65 falls every year, and only less than half of them discuss the fall with their primary doctors.
Okay.
And the falls are the leading cause of death. They're one of the leading causes of death in the elderly. And falls are also the most common cause of traumatic brain injury in the elderly, and the highest number of fractures in the elderly are caused by falls. And worse than the falling itself, with some of the elderly, they then develop a fear of falling. They stop moving, they diminish their physical activity, which puts them even at a higher risk of falling down. And as you know, as we get older, our bones start to get very, very brittle. It's called osteoporosis.
Right.
And the brittle. So like the kids, the bones are very, very soft and mostly half cartilage. So it's sort of like a plastic cup falling down, and when it hits the ground, it just sort of bounces back up. So kids generally with low impact injuries do not fracture. Whereas an adult, it's like a porcelain cup, and when you drop it, it shatters.
Right. We'll get into that. We're going to take a quick break here in just a moment. But when we come back, we'll talk more about that. I want to ask you about, you mentioned that very frequently, the fall doesn't get reported to the doctor, the primary care physician. I want to talk to you about your thoughts on why that is, and some more about elderly and how to prevent and how to assist in a fall. So let's. And once again, Dr. Flores, thanks for taking the time out today. Appreciate it.
It's my pleasure.
So we've been talking today about the elderly and what to do in case of a fall, and you brought out some kind of interesting statistics about how often seniors fall, and I was very intrigued by the fact that most of the time the falls that a senior experiences did not get reported to their doctor, to their primary care physician. I was just kind of wondering if you had thoughts on why that was.
Well, there's several. One is access of care. Like you fall, you're hurting a lot, but you can't get an appointment for 2 or 3 days.
Sure.
Obviously not in an emergency situation, because you can probably hobble around, but you're limping and you're hurting. And another thing is denial. The people will have a couple of falls and say, "Well, I don't have a problem. It's something else is going on. I'm really okay." And it could be something with their medication or perhaps visual problems. And then there's, the older guys, us old school guys are real macho, if you can walk, a real man doesn't go to the doctor for these little things.
Right.
And then you have the nice little old lady who doesn't want to trouble her doctor with her problems.
Well, let me talk to you about that one specifically, because this topic is sort of hitting home to me personally in a few different ways. My grandmother is 90 years old. She'll be 91 in October. And yeah, indeed. And my parents have been the kind of the primary care providers for her since her husband passed away almost, 30 years ago now. So she's been living with my mom and dad. And I live in the area as well, so I also pop in and I spend some time with her on the weekdays when the parents are working, and in the mornings before I come in here to the station. And there definitely is sort of a pride thing. She's full-blooded Italian, 90-year-old woman, and she doesn't want to be a bother to anybody. And so I was over there. This just happened 2 weeks ago. I was over there, and I was in the living room, and I heard a little rustling in her bedroom. And she was trying to do something in the closet. This is another factor that we have with her, is the fact that she does not want to stop feeling like she's, contributing or helping out around the house. This is something, when I was a kid, she helped raise me and my sister. She really feels like she's one of the people that helps out around the house, and she doesn't want to slow down in that regard.
Independent.
Yeah, she loves having her independence, and she's not, even at 90, she doesn't want to just sit around and just watch TV all day. She wants to be doing stuff, So there's a little bit of rustling in the bedroom. I see that she has kind of fallen over a little bit. She's leaned against her walker. I help kind of get her up, and she dusts herself off, and I'm asking her, I'm like, "Are you okay? Is there anything that's hurt?" And she's okay. And this is I guess leading into my question. She appeared to be okay after the fall. All of her limbs and joints were moving okay. She was a little sore, from the fall. But what should I have been looking for? What should I be doing in that situation where she obviously brushes it off as she's being okay? She's moving around fine after the fall. What sort of obligation do I have to kind of investigate further with that?
Okay, well, if she's walking or moving the extremity that was bumped or, fallen upon, that's probably a good sign.
Yeah.
Generally speaking, when you have a fracture, you can't put any weight on it if it's legs, or you can't really you manipulate with the arm or the hand. But if she's using it, it's probably not fractured. Now, again, we're talking about fractures through and through, not the green stick or cracks.
Okay.
Those you're going to move, but just not as well. So you're going to take a look at that. Also, the bones have a blood supply, so generally bleeding. Generally speaking, if you crack a bone or break it, the bone will actually bleed, and you'll see evidence of a hematoma, which is like that knot you get on your head when you bump your head, or you're going to get some bruising to the area. So and other things is if there's some injury, sometimes we know with the puffiness the sensation is down, or there's weakness.
Yeah, and after checking her out and kind of talking with her, didn't see any outward signs of any of that. And this is a woman who has she has fallen before in the past. She's broken both of her hips, got them both replaced at various times. And so if she's not shot, if she's really injured, she will definitely say something. But that was kind of a little scary moment for me.
But again, this needs to be reported to her physician, because there are some interesting statistics. For example, those age 75 or older who fall, they're 4 to 5 times more likely than those 65 to 74 to be admitted to a long-term care facility for a year or longer. And as you know, that women are more likely than men to be injured by a fall, especially because of the osteoporosis. And you said her hips were replaced, so it could be from arthritis. I don't really know what happened.
Sure.
A lot of the falls result in hip fractures. In fact, the fall rate in older women is almost twice that for guys, that are older, and over 90% of hip fractures are caused by falls. So the fact that she's moving and other things that you look for, if somebody falls, older person especially, a woman especially, one leg may be, when she's laying down, one leg may be a little shorter than the other, and then one of the toes of the affected leg may be sticking toward the side instead of, it's sticking out to the side more. So those are some telltale things that they should not be moved or allowed to try to get up.
Right.
But usually they have quite a bit of pain because this is a large bone with a rich nerve supply and a blood supply as well.
This afternoon from Castaic Urgent Care Center, and we've been talking about senior care, and specifically falls and how to, I guess, prevent a senior from falling. And Dr. Flores, thanks for coming back on with us. Let's talk a little about, you mentioned, kind of highlighted prevention of falls before we went out to a commercial break. Let's talk about that. What are some of the things that we can do to kind of prevent a senior from getting into a fall situation in the first place?
Okay, well, one of the first things that I recommend is regular exercise.
Okay.
I really want to increase your leg strength, balance, and there's programs such as Tai Chi that are exceptionally excellent for this, that helps stretching the muscles. Where we have the interaction with balance and muscles called proprioception. So the Tai Chi and yoga type exercises are very helpful for this. So we encourage our elderly to be active as possible. Obviously, if you have a heart condition, you have to do this in consultation with your doctor. But, for most people without the heart conditions, the more exercise is better, especially resistance exercise. And if there's a problem with arthritis, pool exercises are also an excellent alternative.
And you mentioned, stretching, yoga, Tai Chi, things like that. And I think it's important to remember that, we're not expecting our seniors to bend themselves in half and to do pretzel moves and things like that. If they can, great, more power to them. But really, any movement is beneficial at this point. And just kind of doing what you can and doing that as best as you can is, I think, just important.
The old adage, you use it or lose it.
Right.
Okay. And also, they need to talk to the doctor or pharmacist to review their medications. Some prescription and over-the-counter medications can cause side effects, or interactions with medicines can cause dizziness or drowsiness.
Okay.
A well-known medicine, gabapentin, used for neuropathy, has the dizziness as one of its side effects. So it's always good to sit down with a doctor or pharmacist and review the medications, because these may contribute to dizziness and thus falls.
And it might be possible to switch to a medication that doesn't cause that dizziness. Is that possible as well?
Yeah, or has less side effects or less interactions.
Right. So definitely trying to stay limber. That's very important as far as avoiding falls and being able to kind of stay on your toes and be a little bit more active, I guess, is super important. What other things should we be focusing on?
Also, have your eyes checked. Have the seniors have their eyes checked at least yearly, and to have the eyeglasses, maximized for their vision. Because if you're not seeing well, you're going to trip over things. Right. And so walking and these things do rely on our visual axis to be working, and those that are not sighted, would use canes and things to help navigate. And that comes to the third thing is the homes need to be made safe. We have to reduce any tripping hazards, such as these little things on the floor, these right. mats and things that if they're not sticking on the floor well and they tend to crumble up a little bit, the people can fall over those. Similar things, having railings for tubs, showers, toilets, right. to help the elderly get up and down. There's also toilet lifts so they don't have to stoop down so much. These can be discussed with their doctor or physical therapist.
Yeah, several years ago, my parents went through their restroom that my grandmother uses. I was mentioning that I have a 90-year-old grandmother that lives with my parents, and that's one of the things they do. They put those railings inside the bathroom, and they actually eliminated the tub, and they made the shower just kind of a straight access in from the floor. So there's no more having to pick up your feet and kind of go over the tub in order to get in there. That's I think.
They even have those tubs that you walk into and close.
Yeah, you can get those as well.
They're a little costly, but I mean it's another. There's a lot of alternatives and things, but and also other things to lower the fracture risk include getting adequate amounts of calcium and vitamin D from food and or from supplements. Right. And the women over age 65 and men over age 75, we encourage them to get screened for osteoporosis. Dr. Perret is one of the experts in osteoporosis, and the bone densities have really enabled us to be able to predict fracture risks with the elderly. There's a equation called the Frax Index that's based on the bone density. There's a bunch of numbers, but basically your doctor's able to give you a number of what your risk for fracture is in the next few years.
So they can't necessarily predict, but they can give you an indicator of whether or not you are more prone to getting a fracture. Okay.
Correct.
Also, go ahead.
No, I'm listening. It's just not
well, I'll tell you what. Here's what we'll do. We'll pause here. We'll take another break, but I want to come back, talk more about perhaps that. I also want to ask you about. You said getting eye checks, and I wanted to ask you about that specifically. I'm curious if I know your eyes change and they tend to worsen over time. I'm wondering if that continues into old age, into senior care.
Especially into old age, and we'll discuss that when we come back. It's called presbycusis.
Okay. First, from 10 a.m. to 2, Castaic Urgent Care on Castaic Road near Lake Hughes behind the McDonald's. 257-2645 is their number. Also check out their page on our website at hometownstation.com. Our guest this hour, once again, has been Dr. Ben Flores. He is with Castaic Urgent Care. And a point of clarification before we go on. You mentioned something that I don't even know how to pronounce it, Dr. Flores. What was it we were talking about?
I said presbycusis, which is the problem with hearing over the years that we get with aging. There is another problem with our eyes. It's called presbyopia.
Well, they shouldn't have named them so similar. I mean, come on.
Well,
presbyopia.
I had a little brain thing there going on, and I crossed my words. But presbyopia. Now, this is a gradual loss of your eye's ability to focus, especially on nearby objects. It's natural. It's sort of an annoying part of aging. It usually starts in your mid-40s and continues to get worse until about age 65.
Okay.
The lens loses its elasticity, and the proponents of hyaluronic acid have all kinds of claims and stuff about hyaluronic acid, and it helps joints in your eyes and everything. How true that is remains to be seen by science. But the fact is we do lose our elasticity as we get older.
Okay.
you don't see very many 80-year-old contortionists.
No, you do not. So yeah, the body kind of loses its ability to stretch out and to stay limber, right?
Yeah, and my kids were making fun of me. I'm holding my reading material farther and farther, especially at restaurants.
Right.
And I would say, no, my arms are just too short, but the kids got a big kick out of it. And, you have the blurred vision with normal reading distance, eye strain, headaches after reading or doing close work. These are some of the symptoms of presbyopia, and it's totally natural. And, reading glasses generally allow you to see, things a little bit at a more normal distance.
Is this something that can also be aided by taking supplements, taking certain vitamins, things like that, or is it will not help in this instance?
No scientific evidence currently that helps. There are some stuff about macular degeneration and some of the lutein vitamins to prevent macular degeneration. There are, but again, good health, good vitamins, exercise. I mean, it helps a little bit with everything. It's not going to stop presbyopia or presbycusis. Mm-hmm. Nothing really stops the aging changes. I think now that we're into the DNA genetic genome, maybe we'll come up with some, breakthroughs in the near future. But at this time, it's just, maintaining the beautiful machine that God has given you.
Sure. We've been talking about the eyes and, presbyopia and, how to maintain your eye care and what can happen over time. We've been talking about it kind of as it relates to falls and, how to better prepare your body for aging, how to stay limber, how to try and stay in shape as you get older. I want to go back to osteoporosis just a bit, Dr. Flores, and kind of talk about not only, everyone kind of has heard about osteoporosis, and I'm wondering if you can talk to just a little bit about what it is and what we can do and if there's anything that we should be taking to kind of stave it off as much as we can.
Yeah, osteoporosis is a normal part of aging where the bones become weak, brittle, and to the point that, certain things just like standing up, the bones can crush on themselves, especially in the spine. That's where you see little old ladies sort of hunched over with that the back, like that hunchback that they get with age. That's part of nature, yes, but it's part of nature that can be prevented. And you want to talk to your doctor about osteoporosis if you're going through an early menopause, you're experiencing a loss of height, you had a fracture, the bone just broke a lot easier than you would have expected, or you have a family history of osteoporosis. And generally there's virtually no symptoms until you get a collapsed vertebra or a fracture, and sometimes you don't even notice these, and it's just loss of height over time, stoop posture. These are things that demarcate osteoporosis, but by then it's too late.
Sure. And there's no test or anything that we can do to kind of see if it's something that we have or something that we're kind of it might be a pre-existing condition or something that runs in the family, or there's something that goes along with that?
Yeah, there's a ton of stuff, and there's the risk factors. Like women are more likely to develop osteoporosis than men as we live longer. Now we're just showing that women develop it 10 years before men do. Men also develop it. So age, as you get older, your risk increases. White Asian women have a much higher risk of osteoporosis than black women.
Interesting.
Having a family member or sibling with osteoporosis puts you at greater risk, especially if you have a family history of fractures. And men and women with small body frames tend to have a higher risk because they have less bone mass to draw from as they get older.
Okay. So if you're smaller, you have a higher chance of having osteoporosis.
Right.
Okay. Interesting. And sorry, go ahead.
Yes, and what happens is the hormones like estrogen in women is one of the stronger factors for developing osteoporosis. Once they go through menopause, the bones start breaking down more than building up. Okay. Also, during certain cancer treatments, the estrogen levels can drop with some of our novel agents that prevent estrogen from working. And men, we develop a gradual loss of testosterone, the low T syndrome.
Yep.
And some of the treatments for prostate cancer that block testosterone also cause the bone to break down more than build up, because the bone is a dynamic organ. It's not just a frame like a wooden frame for a house or something.
Right.
The bone is constantly building and tearing down. especially with calcium and phosphorus, and it's this dynamic balance that allows the bones to exist. And over time, just like we lose our sight and our hearing, the bones also get more brittle over time.
Yeah. And they lose the ability to kind of